I'm Dr. Babak Larian.
And I'm Dr. Babak Azizzadeh.
Let's talk about large parotid tumors and how we treat them and reconstruct them. The large tumors are a problem because they get more entangled with the facial nerve. The larger they get, the more involvement with the nerve. So we have to be really, really careful finding the nerve, finding the branches, protecting all the branches after we find the greater auricular nerve and protect that as well. So every single nerve branch in there is absolutely and vitally important. And once we find those and we are able to take out the tumor with an extra cuff of normal tissue, now we're left with a gap, a divot, if we don't reconstruct it. That not only will have an aesthetic consequence, but then they'll get phrase syndrome and sweating on the face and all sorts of problems that is totally avoidable because I have you.
When we're looking at large tumors, we're thinking, take the tumor out, which Dr. Larian's a master. Get the facial nerve protected, because that's like very commonly, even a little minor branch can cause like lower lip issues and so forth when with the muscle there. So we want to protect it, especially in benign cases.
Absolutely.
Now, if it's a malignancy, cancer, sometimes it's unavoidable, but we do everything we can. And then also do it through like a cosmetic incision so that we don't have ginormous scarring. And I think that's one of the areas that we've really focused on over the past 2 decades to just make, we want you to go back to your life, live a normal life as if you haven't had anything done.
As soon as possible.
As soon as possible. So, and the last thing is obviously after the tumor is removed, facial nerve is protected. How do we reconstruct it without doing it ginormous? Like we can reconstruct super simple or super complex. So where is that reconstruction? Where's that middle ground where we can get a great reconstruction to prevent like the sweating, to get the jaw lines balanced, get the divot minimized, get the incision perfect. So we'll use a variety of either local tissue like muscles in the sternocleidomastoid muscle, which is this big muscle we have here, or tissue from other parts, so that we can get that area really, really cosmetically and functionally. And that's what the beauty of, I think, all of the things that we do is really, it's cosmetic and functional. That's kind of our approach, and we've really kind of have done a lot of these things together.
We've evolved a lot.
Yeah, and we've evolved, and we've kind of continued our goals of really getting amazing results, safe results, and get you home quickly, or maybe do all of this in an outpatient setting.
I think the other thing we've done is we've tried all the reconstructive techniques that are available and seen the pluses and minuses of all of them and figured out which patients would benefit from fat grafting, which ones the muscle flap is best for them, which ones just need a primary closure, and how we can preserve the SMAS layer to create a smooth contour, which is really the key, is creating the harmony between the two sides of the face once everything is done.
It's not just the skin, it's not the deeper tissue layers. You want to get the tumor out safely, and you want to have the smooth contour. So that combination, I think, is something that you just alluded to that I think is really, really important. And also, I mean, when you're looking at these large tumors, they're very different than small tumors. And with small tumors, sometimes Dr. Larian, is expecting to do a 4-hour surgery. I walk in, and he's like, "Oh, I was able to kind of it was in between 2 nerve branches, and I was able to take it out really, really." With the large tumors, you have to have the ability to understand the facial nerve distribution, where to go, and you are going to, by the end of taking out a large tumor, have a significant, empty space. Yeah. Whereas with small tumors, sometimes the nerve can be, because he knows the nerve just as well as I do, which is wonderful. You have those tumors out very quickly with preserving and protecting the nerve. So it's, I think that's been one of the nice evolutions that I've noticed. And also, I love our nerve monitoring. I think that's also come a long way with really state-of-the-art nerve stimulators, state-of-the-art nerve monitors. That's really helping us, I think.
Absolutely.
Get great results.
Yeah. With the bigger tumors, sometimes it's harder to find the nerve, so having the nerve monitor and the nerve stimulator allows us to get down there safely and find the nerve that may be pushed deeper by the tumor, and then make the whole surgery much safer.
And sometimes we bring third surgeon who is a neurotologist. They're experts of the facial nerve and the structures inside the bone, and we will find the nerve there, really helping us to protect it right back here, which also so it's teamwork to get the best results, putting our thoughts together. Really, I think 2 brains is better than 1.
Yeah.
4 hands are better than 2. So we've tried to really kind of develop this teamwork that's worked really well.
Absolutely, and making the right decisions before we get into the operating room of what we need to do, how we need to approach it. Do we need that third surgeon, or do we not need that third surgeon? All of these things that have come with experience really help get us to a point where we do the surgery really well, get the best outcomes, and then the person can get on there with their life fairly quickly, which is wonderful.